Hi, my name is Mingxuan. I am a research scientist in Department of Investigational Cancer Therapeutics, MD Anderson Cancer Center. So today I'm going to introduce you a web-based lesion selection tool to ensure the accuracy of tumor biopsy acquisition. We also call this tool NAN tool because it was developed by our Team 9 to collaborate with our multiple institutional collaborators. This original work was published on JIPO, entitled Implementation of a Novel Web-Based Lesion Selection Tool to Improve Acquisition of Tumor Biopsy Specimen. So tumor biopsy plays critical roles not only in cancer diagnosis, but also studying drug efficacy and identifying biomarkers, especially in the era of personalized medicine. So biopsy acquisition involves multiple disciplines and requires collaborative efforts from oncology team, diagnostic radiology, interventional radiology, and radiation oncology. So in order to ensure the accuracy of biopsy acquisition, this centralized web-based lesion selection workflow, also called the NAN tool, was designed to coordinate, guide, and track the biopsy acquisition process between multiple disciplines. This NAN-LST tool is an online workflow and incorporated into the department database to guide lesion selection and biopsy acquisition. So this NAN tool LST workflow comprises of 6 steps. Moving forward each step, an automatic notification will be sent out to notify all parties involved until lesion assignments done. So to evaluate this NAN tool, we also conducted a retrospective study to assess the biopsies acquired with or without this NAN tool. So the analysis included 30 patients in the LST group and 50 patients in the control group. So the LST workflow ensured 100% consistency in the lesion biopsy compared with 70% in the control group in the longitudinal collections, and increased the proportion of patients in whom 5 or more cores were collected per biopsy. So in another word, this tool ensured 100% in consistency of lesions selected and enhanced the quantity of the biopsy core number. In conclusion, this novel NAN tool LST platform facilitated coordination, performance, and management of the longitudinal biopsy specimen. Use of this NAN tool enables sampling of the designated lesion consistently, which is likely to accurately inform us the effect of treatment on tumor microenvironment and evolution of resistance pathway. Such studies are important translational component of any clinical trials and research as they guide the development of the next line of therapy, which has significant effect on clinical utility. However, to be noted, so our study has limitations include the limited sample size. In addition, the LST workflow was not completed in 32% of patients. This is primarily because despite the initial coordination among the collaborators, the workflow was not mandatory. Second, as with any new approach, the initial setup and adaptation to a novel workflow required additional time and subsequent efforts from collaborators. Third, as LST was not integrated into the electronic medical records, there was a need to open a separate browser to access. So our next step we would recommend is to validation of this approach in larger study is warranted. Second is, once the NAN tool is validated, its use be made a standard procedure for lesion selection and incorporated into clinical practice. And the third is The time, efforts, and the technical expertise contributing to this effort should be adequately compensated. Thank you.